Thank you, Catherine. It's great to be here and to talk today about our important topic as we are leading into open enrollment. So as we start open enrollment, it's worth noting that we're continuing to build on the progress that's already been made. Millions of Americans have obtained coverage through our first open enrollment periods, including about 2.6 million African Americans and 4 million Latinos. But we still know we have work to do. Millions of Americans remain uninsured, and many of them are people of color, including, as we go forward, about 10.5 million that we expect to be eligible to enroll in 2016, which includes 1.5 million African Americans and 2 million Hispanics. One of the important aspects of the gains that we've also seen includes improvements in access to care. And we've seen that over time that we've seen decreases in the percentage of individuals who are reporting that they don't have access to a personal physician, and small decreases in the proportion of the population who are saying that they have no easy access to medicine. But for many individuals, these gains are not as large as those that we have seen in coverage. And one of the big drivers towards some of these bigger changes in access includes making sure and retaining people as they go through re-enrollment to improve those access changes. And it's one of the reasons that we started the initiative From Coverage to Care. And as we know, for millions of these individuals who've obtained coverage, for many it's the first time or the first time in a long time that they've had coverage. And they may not be familiar with important insurance terms or how to use it to get the care they need. And as you can see, From Coverage to Care is an effort to help educate consumers about their new coverage and connect them to the primary care and preventive services that are right for them. As we know, for many people, it's important to have in-person assistance and to build on those trusted networks. And Coverage to Care builds on those existing networks of community partners to help educate and empower newly insured individuals because they are the trusted resources in the community. We launched Coverage to Care in 2014, right after the end of the first open enrollment period, and we developed a suite of products to help consumers understand their insurance information and to be able to connect to care. We have an enrollment toolkit, which I'll talk about as we gear up for open enrollment, as well as a roadmap and a discussion guide for our community partners who are talking to consumers. And as we know, individuals learn materials in different ways, so we also have developed video vignettes. I know that individuals are interested on the call in learning about where they can get resources, and I wanted to share with you that all of the resources are available to order as well as to print and download through our website at marketplace.cms.gov/C2C. One of the important pieces of connecting people to coverage is making sure that they are to care is to make sure that they start with the right plan. And as we learned at the end of the first open enrollment period, many people selected plans based on cost. But we also know there's a lot of basic information about coverage that has not reached a number of the uninsured. So we developed the Enrollment Toolkit to help our community partners who are working to enroll individuals in coverage be able to talk to them to help consumers pick the plan that best meets their needs and their family's needs. It includes 5 sections that you see here. Due to the time that we have, I'm not going to go through each of them, but I will highlight some of them. And again, you can order copies of the roadmap as well as view it on our Marketplace website. So one of the things that we know is for many consumers, they're still trying to decide why they should get coverage. Many are interested in it, but they don't know in many cases that it's more affordable than they think. Recent data has shown that nearly 6 in 10 of the uninsured have less than $100 left after paying bills each month, and 8 in 10 said they could not afford their coverage. Interestingly, though, 6 in 10 have not heard about or do not understand tax credits and are not looking at coverage as a result of that. And many of the uninsured have not even visited the marketplace to find out more information. So as we're talking to consumers, I think for many of the uninsured, we still have an important message to get out to help them understand why they should sign up for coverage. And the Enrollment Toolkit also includes additional resources at the end of each section to help you as you're talking to consumers, talking about incomes that qualify for lower costs, as well as how to estimate incomes for the marketplace. One of the other sections that we include is what consumers should know when picking a plan. We talk about some of the differences between premiums and actual costs, review provider networks, and encourage consumers to check and see if their provider is in a network before selecting a plan. We also help consumers to understand their prescription drug coverage and to talk about whether or not they're interested in dental or vision coverage. Some of the resources in this section include explanations of the meta levels and how they can find information on the healthcare providers in the networks they're considering. Finally, and really relevant to the call today, we include a section on special circumstances in working with populations such as American Indians and Alaska Natives, individuals with limited English proficiency, and individuals in immigrant status to help understand what they have needs for and how to help them. We include a glossary of healthcare terms for consumers with limited English proficiency, as well as more resources on helping other populations, including people with disabilities and sexual and gender minorities. So that was a very quick tour through an enrollment toolkit. We do encourage you, as you're working with consumers, to talk to them and to look through it, share some of the resources that may be there, and help you as you're communicating with consumers about the importance of getting coverage in this open enrollment period and maintaining their coverage if they've had it already. We move from there. Once we have individuals enrolled, we want to help them to connect to coverage. As you remembered some of those gains I showed you earlier in terms of access to care, we want those gains to grow even larger, and helping consumers understand their coverage and be able to connect to care is one way in which we can do that through our Coverage to Care roadmap. It's a booklet also available on our website. It includes 8 steps. Because of our limitations in time, I'm not going to go through all 8 steps, but just wanted to highlight some of the things that we had in the roadmap. First is step 1, and it includes putting your health first. And this was an important step because as we were developing the roadmap, we talked to consumers, both insured and uninsured, providers, as well as policymakers and other community partners who worked with uninsured to help us think about what were the pieces and the messages we wanted to understand. And for many individuals who are uninsured, they understand the importance of having coverage as something to use when they get sick, but may not think about how they can use their coverage to stay healthy. So we developed step 1 of putting your health first. We talk about messages of staying healthy is important for you and your family, how to maintain a healthy lifestyle, learning what they can do to stay healthy and sharing that knowledge with their friends and family, as well as the importance of getting recommended health screenings and managing chronic conditions. We also encourage consumers to take an active role, and one of the steps where we've developed more information is putting your health first, taking an active role in your health care. We encourage consumers to be active in their health and how that can lead to better care and better health for their family. We also provide some resources to encourage consumers to keep track of their health information and to ask questions. In our second step, it's understand your health coverage. Some of the information covered here is also covered in our enrollment toolkit, but this really is to help consumers understand some of those key insurance terms, such as copayment, coinsurance, and deductibles. We encourage consumers to review their plan to see what services are covered, to make sure that they know the difference between in-network and out-of-network, and to help them understand their out-of-pocket costs. Throughout the roadmap, you'll notice that we have boxes that we call cost tips, and some of the feedback that we received when we were piloting the roadmap is to help consumers understand the financial implications of some of their choices and their health behaviors. So we've put those throughout the roadmap to help people with that information. Step 2 also includes an example of an insurance card to help consumers become familiar with where they can find that information as they call to get questions from their plan or if they call to make an appointment with their provider. Step 2 also includes a couple of examples of cost tables to help consumers see how their deductibles, co-payments, and coinsurance can come together if they are, for example, having a baby or managing type 2 diabetes. Again, these are not real costs, but just an example. In step 3, we focus on knowing where to go for care. We want to encourage consumers to really use the emergency room only in life-threatening illnesses or injuries, and to really focus on primary care for most of their health care needs. Some of the questions that we ask in focusing are, do you know the difference in the cost that you could have associated with care received from a primary care provider versus the emergency department, and how your care might differ? We include a table, and this table is also available as a one-pager for consumers to review. That talks about some of those differences between primary care and emergency care. Again, taking that feedback that we received about helping consumers understand their costs, the first line focuses on some of those cost differentials related to the primary care copayment typically being less than that for the emergency department, and some of the other costs that you could be susceptible for. We also talk about further on down that you can call and make an appointment for your primary care provider, whereas that's not generally the case in the emergency department. And we focus on the fact further down that your primary care provider will often focus on more than just what brought you in for that day, whereas in the emergency department, they really are going to focus on the urgent problem of the day. And again, just really emphasizing to consumers about the importance of utilizing primary care provider rather than the emergency department for non-life-threatening illnesses and injuries. Steps 4, 5, 6, and 7 talk about how to find a provider and being prepared for that appointment. Step 7, because we want to encourage consumers to develop a long-term relationship with their provider, encourages them to think about whether or not the provider is right for them. And for many of our uninsured individuals who may not have had positive experiences with the healthcare system, for many when we piloted this, they found that this was actually a very important piece of information that they didn't know. As one consumer said during our pilot, they didn't know that if their provider that they selected turned out to be Frankenstein, that they had a choice. So we want to encourage consumers to understand and review whether or not the provider is best for them, whether they meet their needs, for example, with language access or accessibility, and if not, to work with the provider or to change if they so desire. In our final step, we talk about what to do after their visit. We encourage consumers to write down in their provider's instructions so they understand what they should do when they get home, to schedule any follow-up visits, as well as fill any prescriptions. And we encourage them to review their documents and to continue paying their premiums if they have them so that they can maintain coverage. We also include in the roadmap an example of an explanation of benefits, emphasizing that while this is not a bill, it doesn't mean that they won't get one. And we try to help consumers understand their information and be able to read it so that if they have questions, they can follow up with their health plan or their provider. The roadmap also includes additional information, such as a fuller glossary of health coverage terms. We include a resource list of other resources that have been developed by some of those in our federal family. We also include a personal health tracking checklist to get consumers to understand some of their specific health indicators. And finally, on the last page, we include health information such as their coverage and provider contact information. We have worked with our community partners to translate the roadmap into 7 languages, as you see here. Includes Spanish, Arabic, Haitian Creole, Russian, Chinese, Vietnamese, and Korean. And we also have worked with our tribal affairs group to develop one that is unique to the individuals who are members of our tribal communities. Again, all of these are available for free through our Marketplace website. And we continue to develop additional resources because we know that as individuals come into coverage and are entering the system maybe for the first time or the first time in a long time, it's going to be a process, and that we will continue to need to support them as they journey from coverage to care. We also offer for the roadmap an opportunity for those of you who may be interested to customize on our website the inside covers and the back covers of the roadmap to add local information or information about your organization if you're a navigator or a sister or helping individuals enroll, to provide some of those local resources. And that's available again through our website under the roadmap, and you can see the other products we have listed. So as I close and sort of think about what you can do, we encourage you to share the resources. We know that many organizations have customized some of their own resources or developed theirs, but this is an important piece of helping our consumers understand and retain them throughout open enrollment and throughout the year to retain their coverage and come back to sign up again. We encourage you to customize them to your community. If you're hosting local events or doing outreach, to consider incorporating the roadmap in. And each state, as we know, is very different within their Medicaid and CHIP offices, so we encourage you to work with them to tailor some of the resources to your specific state, and to think about ways to engage providers and issuers. And finally, to let us know what works. As we said, we've had millions of individuals who've gotten coverage. We still have millions more, and we will be here to support them as they move forward in their process. So as I close, just wanted to share with you resources, a link to the Marketplace website, and if you have questions, to please email us and provide us with your feedback. Thank you.